year, millions of lives are impacted by lung cancer, both men and women. In 2024, around 2.5 lakh of patients were diagnosed with lung cancer worldwide, and of them, 1,25,000 were died because of the disease. And most of the deaths were due to advanced disease. Because we have seen many patients present to the clinic or the hospital for the first time with a very advanced stage of disease, which makes the disease almost incurable and also impact the survival. So lung cancer is most curable when detected at the early stage. So detection of the disease at the early stage is very crucial. With the advanced investigations, advanced tests, we can detect the disease at the very early stage nowadays. So who are the candidates who are at high risk of developing lung cancer? There are risk factors of developing lung cancers like cigarette smoking, like secondhand smoking, some genetic factors, and also the environmental factors also play a role in causing lung cancer. So do we need to test everybody who are smoking? There is clear-cut guidelines for detecting the candidates who are at high risk of developing lung cancer, and these people should be tested annually with low-dose CT scan. Who are those candidates? If you are 50 to 80 years of age, if you are smoking 20 pack year of cigarettes, 1 pack year means if you are smoking 20 cigarettes per day for a year, it means 1 pack year. If you are smoking for 20 pack years, you are at high risk. If you are a current smoker or a former smoker, you are at high risk. So if you qualify to be a high risk candidates for developing lung cancer, this is the time you should get your test with annual CT scan, low dose CT scan regularly. So what is the test to detect the lung cancer at the early stage, which is called a low dose CT scan? So why low dose CT scan? Because it's almost similar like a regular CT scan, but it uses 75 to 80% less radiation dose than a regular CT scan, for which there is complications or the radiation hazards are 75 to 80% less. And also it can create a very high definition 3D images of the lung and also surrounding tissues to detect the cancer if it is there at the very early stage. There is also no need of needle biopsy, and it's almost less time consuming, and it's almost simple test with lot of advantage. What if the low dose CT scan screening test comes negative? So it's a good news, and you have to reduce your risk factors as soon as possible and have to continue your annual low dose CT scan screening regularly. What if your low dose CT scan screening test comes positive? Your doctor will advise you some further tests like a needle biopsy from the tumor, a bronchoscopic evaluation to see the airways from inside, and also to see whether the disease has spread to the other sides of the body. They will advise you to get a CT scan done or a whole body PET scan done to stage the disease. All the disease which are detected on a low dose CT scan tends to be very early stage, so you may not require all the investigations at the early stage of the disease when detected with the low dose CT scan. So what are the risks associated with the low dose CT scan? First of all, there is a risk of radiation hazard, but this low dose CT scan uses 75 to 80% less radiation dose than a regular CT scan, which is very, very less. And also there is a risk of developing a false positive result. So what is false positive result? You may not have a cancer, but may have some other disease, benign disease, which is detected on the low dose CT scan. So your doctor will advise some more tests to detect and to confirm the disease is not a cancer. So it's a regular question like, why not an X-ray done? You might wonder, why not a X-ray? Why the CT scan is required for detecting a cancer or a very early stage cancer? The answer is simple, because over the years, the researchers have investigated and have found that CT scan can detect the lung cancers, both squamous cell carcinoma and adenocarcinoma, at the very earliest stage when compared to simple chest X-rays. And also there is 15 to 20% less chance of death when the cancer is detected on a low dose CT scan screening test. So if you qualify to be a high risk candidate, get your low dose CT scan screening annually. Early detection is the key to fight the lung cancer. If you are qualifying as a high risk candidate, get your low dose CT scan done annually. Together we can save lives. Thank you.